A 57-year-old woman with a long history of chronic abdominal cramping and malabsorption presents with worsening symptoms. I am showing you an image from a small bowel follow-through study. Describe the findings.
Okay, looking at the images, the fluoroscopic image demonstrates diffuse, mild dilatation of the small bowel loops. There is an abnormal fold pattern characterized by an increased number of folds in the ileum, mimicking the jejunum. Additionally, there is a focal segment of marked aneurysmal dilatation in the left lower quadrant, containing numerous irregular filling defects and complete effacement of the normal mucosal pattern.
The diffuse small bowel findings, dilatation and ileal jejunization, are classic for what underlying chronic enteropathy?
Based on that, these background findings are the classic radiologic hallmarks of advanced celiac disease, also known as gluten-sensitive enteropathy or non-tropical sprue.
Given the underlying diagnosis of celiac disease, what does the newly developed focally aneurysmal segment with filling defects represent?
In that case, the development of a focal cavitary mass with aneurysmal dilatation in a patient with celiac disease is highly suspicious for a superimposed primary small bowel lymphoma.
What specific rare histological subtype of lymphoma is uniquely associated with untreated or poorly controlled celiac disease?
These patients are specifically at a much higher risk for developing enteropathy-associated T-cell lymphoma, or EATL.
How would you manage this patient as a radiologist?
I would immediately communicate the findings to the patient's gastroenterologist and the hematology-oncology team, raising the high suspicion for a complicating T-cell lymphoma. I would recommend a staging CT of the chest, abdomen, and pelvis to assess for lymphadenopathy and a deep push enteroscopy to obtain a definitive tissue diagnosis.